everyone, so today I'm going to be talking about white line disease, the signs, symptoms, why it happens, as well as how you can help prevent it for your own horses. I always recommend you do your own research and your own readings in order to get as much knowledge as possible on a certain topic. So I'm going to link all of the research articles and textbooks that I used below. First off, what is the white line? It's found between the hoof wall and the sole of the hoof if you're looking at the hoof from the solar surface or the bottom. But the easiest time to see it is really when your horse has been freshly trimmed by the farrier. The function of the white line gets a little bit complicated, so without overwhelming you, here's what you need to know. The coffin bone is connected to the hoof wall via lamina. The coffin bone, the outside of it, is covered with sensitive lamina, and the inside of the hoof wall is covered with insensitive lamina. When they come together, they form sort of a locking mechanism like this, or you can think of it as Velcro. What this mechanism does is it allows the weight of the horse to be transferred from the coffin bone outwards to the hoof wall instead of this tiny bone taking all of that weight and pushing downward. So where does the white line come in? At the distal end of the coffin bone, the sensitive lamina will end, because remember, it's covering the coffin bone. At the same point, you also have the sensitive sole, which produces the epidermal sole. You have the continuation of the hoof wall. From the tip of the coffin bone downwards, you would have a gap if there would be nothing. What happens is at the distal end of the coffin bone, white line is produced. This white line serves to kind of fill the gap between the hoof wall and the sole, kind of a junction, if you will. Because of how the white line is produced, it really serves as a blueprint of the actual coffin bone itself. It's very helpful for farriers to follow this white line and see this white line, and we can therefore kind of see the shape of the coffin bone. White line disease is essentially when bacteria and or fungi get into the inner hoof wall, they proliferate, so they multiply, they begin to eat the keratin of the inner hoof wall. As this is happening, the outside of the hoof can look completely normal, but on the inside, it's rotten. I want to make a distinction here because some people get confused between thrush and white line disease. Thrush is going to be affecting the frog and the commissures, as well as sometimes the bulbs, whereas white line disease is really following the hoof wall. That's what it's attacking, the inner hoof wall. White line disease is kind of an interesting pathology because there's no firm consensus on why it happens. There's a lot of articles that say it's more prevalent in wet climates, but as I'm sure many farriers who work in dry climates can attest to, it does exist in dry climates as well. One thing that is agreed upon is something happens to weaken the hoof wall. This allows bacteria and fungi to enter. With the appropriate conditions, the appropriate environment, this can lead to white line disease, so they can multiply and then they can begin to eat away at the keratin. Something really important to note here is that white line disease, if it's not stopped, it can continue to work its way around and up the hoof. I've definitely seen cases where 3/4 of the hoof has been compromised. On the outside, the hoof wall doesn't look too bad, but inside just completely rotten. So signs and symptoms get a little bit tricky. The ideal way to catch white line disease is by having your farrier show up on a regular basis, just staying with a consistent trim schedule. One of the signs is a sort of chalky, rotten looking white line area, hoof wall area from the solar surface of the foot, but it is pretty tricky to see if you're not trained in it and if you don't dig away a little bit. When the sole is ready to be trimmed, the sole itself can get flaky and chalky, so it can be hard to distinguish between white line disease and the sole. And again, it's really important to note that the hoof, it's the wall itself, and even sometimes the solar surface can look pretty normal, and it's only when the farrier begins to trim that they're really going to see that there is white line affected. Sometimes there's a crack in the hoof, but not all cracks have white line disease, and not all cases of white line disease have a super evident crack in them. In the early stages of white line disease, there's usually not any visible discomfort. As the disease progresses and as the white line disease kind of works its way up the hoof, you can start seeing signs of discomfort or lameness. You definitely want to catch it before it reaches this point, because as it's working its way up, remember how the coffin bone is attached to the hoof wall? Well, that attachment is being kind of eaten away, which can obviously cause some internal issues. And again, this is why it's so important to have your horse on a regular trimming schedule. Your hoof care professional will easily be able to spot this and prevent it from working its way up the hoof. With white line disease, to treat it, you're essentially wanting to expose the bacteria to oxygen. They thrive in an anaerobic environment, so without oxygen, and when they're in this sort of pocket that's created, they're thriving. So essentially what farriers will do is they're gonna resect the area, so they're going to take away the hoof wall, the external hoof wall, all the way to the point where the white line disease stops. So if it's to here, they're gonna take it to here, and if it's higher, sometimes it can look quite drastic. But what you need to understand is if you leave the hoof wall there, there's always a slight risk of the bacteria being able to continue to do damage. So you really have to get all of the affected area out and clean. That's your best chance at success. Normally, when this is done properly, the hoof wall just grows back as per usual, and there's no lingering effects. Definitely with more severe cases, sometimes you have to apply a therapeutic shoe to help redistribute the weight. In general, there's a really great success rate. If you're catching it early, you really don't have much to worry about. Something to mention is when the farrier is done taking the infected area away, sometimes they're going to suggest applying of a product. Copper sulfate usually works very, very well, but in other cases, oxygen just does the job and there's no need to apply another product. Whatever your farrier recommends, go ahead with that. The absolute best prevention for white line disease is to get familiar with your horse's feet, pick them out every day, just keep a close eye on them. And of course, having a regular trimming schedule will do wonders. Your farrier will be able to catch white line if it is happening. You want to keep your stalls clean, you want to keep your paddocks clean. So I hope you enjoyed this video. I know that especially this year, white line disease in my area has been super prevalent, and so I figured that I would make a video explaining certain aspects of it. I tried to address as much as I could in this video, but it's a very in-depth subject. If I missed anything, forgive me. I hope everyone has a beautiful day, and this is the first episode of a pathology series that I'm going to be starting, so yeah, stay tuned.